A regenerative system is being used for people struggling with knee issues. The procedure is targeting knee repair rather than knee replacement. Here to tell us all about the new procedure and the 4 components of it is the owner of Victory Sports Medicine and Orthopedics in Skinny Atlas, Dr. Mark P., physician assistant Jordan Reynolds, and patient Diane Harper. Good morning to you all. Thank you all for waking up with us. We appreciate it. Diane, I'm going to get to you in just a moment. We talked during the break. I want to talk to Dr. P first. How did this system come about? Because for years, people have talked about knee replacement, and we've seen advancements in that, but this seems like it's a step beyond an advancement for a replacement.
Yeah, well, first of all, thanks for having us on.
Absolutely.
And thank you, Jordan, for arranging for this. So, yeah, we're here to talk about our knee repair, not knee replacement trademark system. And this is a knee replacement, a traditional knee replacement, metal, plastic, cement. And we're not here to bash knee replacements because knee replacements are a very good surgery in certain circumstances, in certain hands. But, you know, certain studies have shown that maybe 25 to 35% of them are unnecessary. So I'm a surgeon. I still do hundreds of surgeries a year, but what we find is a lot of our patients come in, they don't want surgery if they can, you know, who wants surgery if you don't need it, right?
Nobody.
So that kind of led to us developing this knee repair, not knee replacement system, and it has several components to it, some of which are regenerative, which allow the body to repair itself as opposed to having to replace it with metal, plastic, and cement. And what we concentrate on, each patient's different and each patient has their own goals. So we kind of concentrate more on the goals, not on the MRI or the X-ray. I mean, those are important, but we concentrate on their goals and then we come up with a personalized system for them. And then once either Jordan or my physician assistant, myself, or our nurse practitioner, Steve Berwin, perform the minimally invasive procedure or procedures in the office, rarely in the operating room, then we hand it off to our total body fitness experts and they take it from there and help our patients achieve their goals, which we found that many were achieving their goals just as much as knee replacement, if not more, and Diane's one of those people.
She was achieving her goals walking out of that office after the procedure. One more question for you, just to follow up. From start to finish, how long are we looking at? If I walk in today and say, you know, I'm coming from this other doctor who recommended a knee replacement, I want a second opinion, what are your thoughts and how quickly can we have this all done? When will I be back up walking my dog?
Sure. Well, everybody's different again. So a lot of people come, they already had their X-rays, MRI, whatever. So we like to look at everything. Then we like to have an hour-long consultation with the patient. So, I mean, you know, a lot of doctors' offices, 10 minutes, you're in and out. So we spend an hour, we really try to learn what their goals are. And once they decide and we decide on what that personalized treatment is, they certainly come in and they walk in and walk out the same day. But, you know, the first 2 weeks, I would say, are the most, you know, restrictive. Not as bad as a surgery, certainly not as bad as a knee replacement. But it can take, you know, most people are about 50 to 90% better by 6 weeks. Wow. You make your most improvement over those first few months. So by 12 weeks, you've reached your maximum rate of improvement, but people still improve 4 months, 6 months, a year out, and Diane, again, is a good example of that.
Yeah, Diane, talk to us here. So you had this procedure done, and you literally walked out of the office. What was that experience like for you?
Well, first of all, I thought I was going in for a consultation. I didn't realize we were actually going to do it that day.
So I guess you can get it done pretty fast.
Yeah.
Not everybody, but yeah.
They take blood from my arm. He took bone marrow from my hip. He mixes them up somehow, and then he injected it, and that was it.
You were done.
I was done.
And they gave you a walker, and you said, I don't want this, and you just walked out of the office.
I didn't need it.
Walked out of the office.
Yeah. And my car is standard shift, so I have a clutch. They wouldn't let me drive it up there because
you'd have to leave in it.
I drove it the next day.
Diane is defiant, a rule breaker, and I like her attitude. You got a good outlook. Now,
it's important.
Well, it is, and the treatment after the actual treatment is also important. Can you speak to that?
Absolutely. So the most important thing, I mean, just like any surgery, the physical therapy afterwards is almost as important, if not more important, than the procedure itself. Additionally, we have something in our office called laser therapy that we have people come in for. That's also very helpful in the healing process. So yeah, it's, you know, Diane still, she said she's been coming in for physical therapy still, and it still really helps her. So, you know, the treatment afterwards is very important, not just the first 2 injections that we do on that first day, but overall, it's the entire package together that really makes the biggest difference.
It really does. I mean, you're living, walking proof, healthy proof of it. We like that.
I don't even think about it anymore.
See? You know, you guys need to hire this lady. Dr. Pete, we're running low on time. Can you just tell us the website real quick? People can go.
VictorySportsMedicine.com or VictorySurgeon.com, either one of those.
Perfect. We'll post all of that on our website, foxrochester.com, after the show. 8:52. Your headlines are up after America Steals and Deals.